Welcome to my channel, Conversations with Dr. Sue. I'm Dr. Susan Musicant, counseling psychologist, author, and foodie. Today, I'm very honored to have two guests, Dr. Blackie Swart, maxillo-facial surgeon, and his patient and my client, Shannon Riley. She is going to tell us the story of her 19 years as a cancer survivor and having undergone something like in excess of 30 operations to reconstruct her jaw after cancer, and her resilience and courage and spirit that I honestly will believe will be an inspiration for anybody who's listening, either those who have been going through what she's been going through, or any of us. It certainly brought tears to my eyes, and to Dr. Swart's caring and love for his patient that I'm quite sure has seen her through all these years. He himself says that with her condition, it's usual that a patient survives for 5 years. She has survived well for 19 years, and that's amazing. Welcome, and thank you for coming to my home in Langebaan and agreeing to come and talk with me about something that really struck a chord with me. Just a little backstory, a short backstory. Shannon came to me as a client probably under a year ago. And she told me her story of resilience and courage. And while she was speaking, she was telling me about her maxillo-facial surgeon, her favorite one. And this was Dr. Blackie Swart. And I have to say, Blackie has just been presenting at an international conference, and he agreed to come here. He's been home, he's just landed, he's still trying to get his sea legs, but he's agreed to come because he told me on the phone that he loves you. And so we are here today. And what would help is if Shannon gives us some of her story, and then I'm going to ask how you joined in. And I'm going to interrupt because that's my style. Around about 19 years ago,
Yes.
you found that you had an abscess in your mouth.
I had an abscess and I went to the dentist, and then he said, well, we could either do root canal or take out the tooth. So I went, take out the tooth. Anyway, but then it just never ever got better. And my mother's dog bit me even on my face, and I had more antibiotics. So I'd had antibiotics, penicillin, everything. And then I went back to the dentist, and he went, I'm going to send you to Dr. Swart because he needs to look at it. And he just said, take a friend with.
He was
No,
worried.
he knew, because apparently that's it. It's like soggy, it doesn't heal. Anyway, and that was the start.
The first people that we should recognize, Shannon, I think is Prof. van Zyl and Ottie van Zyl, because without them, it is our team, and thereby we give the support and the surgical know-how to this. So I was the first in line. I just came out of theatre. We were busy with an oncology case, and I was late. I tell the joke. And I was in a rather rush coming from theatre, and I knew this emergency patient was waiting for me. So we had just done an operation where we took a patient's jaw out to remove cancer. and I did not have much time. I did not have time to comb my hair and that, and I was just out of my scrub gear. And I came into the office and I saw Shannon and a friend, and Shannon started laughing. I didn't know exactly why. It only came out much later because I'd forgotten to do my zip. And Shannon thought this was awkward of a surgeon. But anyway, I had a look and immediately realized there was a problem. But because our team was so smoothly oiled, it was very easy to take Shannon to the next level. So I immediately took a scrape of the inside of her mouth. That's the minimum that we need to make a diagnosis. And already sent Shannon for chest x-rays to make sure there was no metastases and so forth. And I saw her, I think it was on the Tuesday, and she was booked for the Friday.
Wow.
It was very quick, and it would not normally take so quickly.
Right.
But in Shannon's case, everything just worked very well. And
can I ask, from the time that she got the cyst to the time that she went in for the first operation, was what kind of time? Do you know, was that 6 months?
Shannon would tell you from when I saw her, it was a week.
Yes, 2 days.
It was 2 weeks.
Was it 2 weeks?
Yeah. Okay.
Was remember I had to go to different doctors. I
Yeah,
had to go
yeah.
I had to go to the plastic surgeon. I had to go to the physician.
Okay.
So I was busy every day.
The professionals, and
Yes.
was it you plus other professionals in that first surgery?
Yes, it's always we worked as a team together.
So it's yourself, maxillo-facial.
Facial. And there was a surgeon. He unfortunately passed away now. He's Professor Jacobus van Zyl. We all know him as Kop van Zyl. And he had a super speciality that's unique to him. He was a head, neck, and breast surgeon. I mean, there is no speciality like that.
Right.
But he had, in Tygerberg, had cloned that position for himself. And he was a very, very impressive surgeon. The only thing that made him not a world-renowned, well-known name was he struggled to speak English.
Oh,
That just takes nothing back from his abilities as a surgeon. I think he is the surgeon that taught me the most, even more than my own profession, because we spent many times, and I think I was at times his blue-eyed boy, so it helped.
So not only do you have an impressive bio, but you're humble at the same time.
Yeah, I cannot stand on the same stand as Prof. Van Zyl. He's just exceptional.
Okay, and then the third one
is Dr. Otti van Zyl. He's still in practice. He's a plastic surgeon, and he helped Shannon in many ways, in many times. At that stage, we took a piece of her fibula with the vascular side, and we then attached that to her neck, and the resected bone was reconstructed with the fibula.
Wow. And how was that for you? That was your first experience of an operation. You'd gone from no cancer, from a cyst, to major surgery and taking part of your leg to put in your jaw.
Yes.
And how was that?
It was amazing.
It was amazing.
In a way that you think this can't be happening, and they tell you I had hair growing in my mouth.
Oh my goodness.
No, I did. Because
Sure.
from what they take, and you have hair growing, and that was quite strange. And, you know, also that you've got your foot, not your foot. I mean, I normally have my foot in my mouth, but I mean my bone. And yeah, but when I came out, I looked like I look now. No, not like now. I mean, I looked like I used to look because I was straight. I had no I mean, it was really unbelievable. You wouldn't have said they cut in the crease.
Right.
And then when I went for radiation, that's when the hair stopped growing, because they told me it will kill it.
On your head as well?
No.
Just in your mouth?
No, in the mouth where the hair grew, that
yes.
died. And yeah, but unfortunately the radiation had other bad effects.
When I met Shannon, I met this extremely positive, resistant woman, a stronger person that I have met few of equal balance.
Like resilience of note.
More than that.
Okay.
She took the news of a major surgery not lightly. She took it seriously, but she was positive about it. She was always positive. And one thing that I can remember is the very first time that she opened her eyes. That was just the times of Lance Armstrong.
Yeah.
And I took her the book, It's Not About the Bike.
Okay.
And I said, Shannon, I cannot tell you more, but read this book.
It's not about the jaw.
Yeah. And afterwards, there was so much controversy about him. But when I read his book, it was such an inspiration. Because the best thing is, why not me? Because a lot of people go, why me? Why did it happen? And you can't. It happens to so many people.
When I met Shannon for the first time, she has a spirit about her. She came into my rooms, how many years later? 19 years later, with an upbeat spirit, always dressed so beautifully, with a sparkling blue eyes. And I think, had I been in your position, when I have a cold or a chest infection, I moan and groan, and I'm not positive like this. You are an inspiration, and this is not just after the first surgery. Please continue.
After, I think, about a year, I started getting abscesses again, and I got osteonecrosis, which
means
the bone starts to die.
Okay.
So the new bone started to die. So I had to have quite a few little surgeries to get out the bone.
To take out the leg bone.
Yeah, the leg bone, and I also had part of my own bone there, but that was also dying. So, and obviously you can't have dead bone in your body. So I was backwards and forwards a lot, because between you and Dr. Blackie Swart, I had to go between the two of them to see that the bone and to keep my face looking quite good. But unfortunately, I had to have the whole operation redone again.
The same operation that you had right at the start?
Yes.
Can I just ask, where were you work-wise at that time?
I was front of house for a very busy restaurant.
Amazing.
I know. I think in the beginning everybody thought when I told them what the operation was, but when I came out I looked fine. Everybody was like, fine, you can do the job.
And they offered to keep you on?
Oh no, I was very lucky.
You were fine.
I worked also for an amazing person. And he, from the beginning, I'd only worked for him for 6 months, and I had to go, I'm sorry, I've got cancer. I'm taking you off 3 months.
Do you want to give him a punt?
I do.
Do then.
Charles Black.
Charles Black?
Yeah, from Fairview.
From Fairview. I think anybody along our life journeys who give us that kind of gift deserves a punt.
Yes.
Whether they're the surgeons or whether they're those people who shine a light on us and help us on our journey, they deserve a punt.
Yes. No, definitely, because most people have said whatever, like, I can't take you on. And afterwards I had to have a lot more time off, which we never knew at that stage, because it just, and you know, I've had 25 surgeries, without teeth. Teeth are different.
Without teeth?
Yeah, no, I don't put them in as
teeth
operation.
Related.
Oh, not teeth related.
related.
Yeah, sorry, it's silent. But I had to have a lot of times that I had to have implants and things done with my teeth.
I can maybe just add in for Charles. He actually came to my office without Shannon knowing about it. And he said he realizes that Shannon needs time off and she can take off as much time. And he wanted to know what additional things he can do to support her.
Wow.
So what a man.
What a man. What a man. Cheers to him.
Yeah, thanks.
And then?
Maybe I can talk a little bit more about osteoradionecrosis. What is osteoradionecrosis? So if you have a bone that fractures, it takes approximately 6 weeks for all of these factors to meet each other and to knit.
Right.
And then it takes another 6 weeks to remodel so that you get a strong bone, and that bone can, it's like any bone fracture that you have. But the most important factor is the amount of blood vessels that grow into this angiogenesis. It's just new blood vessels that grow in. And because of radiation, Shannon unfortunately needed radiation after the surgery. So now she had this massive dose of radiation, and those blood vessels are then restricted. And anything that happens is the bone doesn't knit properly. And then at some stage, in a few patients, what happens is it becomes necrotic. Though there is no blood vessels in that area again, and it's absolutely like a dead piece of bone that's in there. So you cannot just go, okay, we've got osteoradionecrosis, now cut it out and we put a new piece. We've got piecemeal, take out the necrotic bits until we've got bleeding bone again, thus out of that radiation beam, and then we can reconstruct. And that is what Shannon says we've been in and out many times. Yeah.
And the necrotic bone, as I understand, does damage if you leave even a bit in the jaw. Does it cause inflammation, infection?
Absolutely, it causes infection because the inflammatory response is secondary to the infection that you have. But it is the true infection because there's nothing that can, your body can't resist it. There's no of your own, your body can't fight it because there's no blood. And once there's no blood, it's dead. And once it's dead, the body wants to push it out. And if you don't look after it, it spreads and spreads and spreads.
It's almost infectious to the
surrounding. Yes. And it becomes bigger and bigger. Okay. You must realize that when we first took out the tumor, it was from up here to here. Wow. So if we just take it, it would be from that point to here. That was our first surgery to reconstruct that area.
That was the tumor.
It is the tumor with, you've got to have area of well-defined healed tissues around it. So that was part of the tongue, part of the mouth floor, part of the outside, and all of the lymph nodes in the neck had to be dissected to make sure that she was clear.
And by the time the next surgery happened, a year later, did you find there was no trace of cancer? It was more about the bones.
Luckily. For Shannon, it's now been 19 years and she's been free 19 years. Wow. But one must remember, when the first surgery is done, one has also got to, you've got to have an experienced team, and that's why I give so much accreditation to Provençal, because it is the maintenance thereof in the long term and the stability in the long term, with all of these other factors coming. Because if you read Google and you Google this and the surgeon does that, and which is we are so overloaded with information at the moment, a lot of misinformation done, and also professional misinformation, and this fake news that we have. All of that is, to me, a little bit derogatory to surgery, because that you've got to look at what's going to happen in future.
The bigger picture and the future.
Yeah, and we would have loved all the cases to go as, you know, as Shannon looked that first year. But unfortunately, life happens, and there's things beyond our control that happened to Shannon.
And then I had lots of little until
to take the necrotic bone out to heal, give a chance to heal.
Yes.
Right.
So I continuously had abscesses, you know, so I was always had little plasters and things.
On the outside?
Yeah.
On your skin?
Yeah.
Okay.
Anyway, and then until...
Maybe you can explain why, Shannon.
Because the body tries to get rid of the bone.
So it's pressing out abscesses through your skin to try and let the poisons come out. Is that
the area here was actually making another mouth. It was open towards the outside, so she could never close it. As soon as we tried to close it with a stitch, it would open again. So the body was trying to form another orifice.
That's amazing. That's actually genius. I mean, you don't want another mouth here on the side of your face, but the way in which the body thinks, the memory of the body, is trying its best to get rid of the toxins. And so what happened?
And then in 2013, I thought I needed to redo the operation.
The whole story?
The whole story. We had to redo it again. And unfortunately, Provençal, he'd passed away.
Before this operation?
Yes, he had passed away. And so then I went to Parfagan and to Otti. So I had bone from my left leg into my jaw again.
So on your other leg, left of bone?
Yes.
So you were in that surgery with Shannon?
Yes, because of the bone that we had to reconstruct in the mouth.
At the Kingsbury Hospital.
Yes.
And so I needed to say, whilst you were still positive, at this stage, were you still feeling quite upbeat, quite positive?
No.
And when you weren't feeling as positive, I'm sure that there are people who are listening who some are more positive, some hit a funk, and then they need to lift up. What would you say to them who are feeling very desperate when they're going through this kind of process? Where did you get this core of steel inside you, and spirit and sense of humor?
Well, everything's funny, actually. You just got to look for it. And I think once you have what I've been through, if you don't laugh, I think you might just spend the day crying, you know, because things happen, people say things. I mean, people have said the most ridiculous things to me. And sometimes I've had to really kind of go, oh no, I don't know what I'm going to say. Or I could have got very angry. But then you feel sorry for them because, you know.
It's more a reflection on them
exactly,
than on you.
Exactly.
So do you let it go off the top of your head? Do you try to let it go off with a joke sometimes?
Yeah, I just kind of like what, you know, but that's the worst. And what I would say, look, I don't know where I got my strength from. I'm just a very strong person. And I set myself goals. I never thought I'd get to 50. So I wanted to get to 50. And it was a very good year because my son was turning 18, my daughter 21, and I was 50, all in the same year. So that was, then when I put 2, I got to 6, then I'm going to get to 60. And
so
now,
you set
goals,
future
yes.
goals for yourself,
Yes.
and that's helpful
Yes.
for you.
Exactly. And then also I thought about a lot of other people. Imagine that I couldn't walk, or imagine I couldn't see. You know?
So with everything that you were going through, you would look at people who were worse off
Exactly.
than you and think, how would I cope if I was in a wheelchair?
Yeah. And I didn't have that. I mean, I had all my other facilities. So, I mean, my speech is a bit slurred, and I mess when I eat. There are things that aren't great, but I mean, they're little. You know, imagine not being able to get up out of your bed, you know, so.
It's quite amazing after this many operations and everything that you've been through. Did you have the experience of pain
No.
through these operations? Was there no analgesics needed?
No. And I'm terrible on morphine. Don't ever give me morphine.
Do you dance with the fairies?
With morphine, no, I shout and I scream and I swear. I'm like a different person.
So they're not the fairies,
no.
They're the
devils.
So the devils.
I don't know who.
Right. Okay.
But no, and they don't now give me morphine because I really, no, it's not a good thing. So, but I don't have any nerves from here to there. So, which is great. It's not great because I can never feel, you know, if I eat other food, my friends all go, you know, and they tell me, which is good. And I drink coffee and I have coffee running down, so I can't feel it. So those are a few things.
Like you've had a fair amount of support besides from the professionals.
Huge support.
You must also remember that the type of cancer that Shannon had, it spreads along the nerves itself, and it's a very aggressive type of tumor. And the average life expectancy is 5 years.
Wow.
So for us to have reached the 19-year mark, Shannon's face, as you see Shannon today, I hope you will show some nice pictures of her, because she's a very beautiful woman. And now, from the outside, still, she's beautiful, but from the inside, she's golden.
More so.
She's golden.
While you have walked this journey, have you felt the universe with you or a higher power with you? And while you're working, do you get a kind of strength from the universe or a God figure or something? I just wondered where spirit sits with you on your journey, with you in your profession, like with this.
You can't get through this without faith. You've got to have faith. Okay. And you know, it was quite amazing that I worked with people, and I worked at Fairview for many years. And people used to come up to me, and I didn't know them, and they'd go to me, "Can we pray for you?" And I'd say, "Sure, you can pray." And then they'd stop and they'd start praying in the middle of the restaurant. And I sometimes just think, oh, I don't know what everybody will think. But you know what?
They're eating lunch and here's this group.
Exactly.
Why not?
And I had so many people that just were there for me. And that's in every way.
Special.
Very, very special.
One of the compliments I had in my job was that one of the spiritual people came to me and said, "You know, Blackie, you've got a green aura around you." And I don't know where it came from. I don't deserve it. But when I treat patients, I go into a different mode. I zone into the problem itself. And I hope that I never do it for myself. I hope that I always do it for my patients. And when Shannon comes in, I am a person that likes to touch because I can immediately feel your response. I would never want to do it inappropriately. But with Shannon, I always give a hug and I know where Shannon is at that time. So I think we've got a spiritual bond that is second to none.
And the fact that we came together here now says something to me about this is not coincidence. How on earth did she come to me as a client? And by the way, at this stage, after 40 plus years in practice, I'm not good at treating anybody. We need to have a love. Like you have with Shannon. I need to feel that connection. She needs to feel that connection for us to be able to grow together and move together. And sometimes a scientist, I've got family who are scientists, and I ask this kind of question. It's a bit sensitive, but I ask the question, being a scientist, how do you feel about the universe and health for you? No, we scientists, we believe in the science. My wife believes that there's spirit or there's life after, but my uncle and my cousin, serious scientists, they said no. But you feel it off them. Like you talk, when you touch Shannon, you feel her energy. My uncle and my cousin were so giving this wonderful energy and doing good in the world, whether they believed it or not. And I didn't fight them. I just said, okay.
You don't get doctors like Blackie, okay?
In general.
No, in general, okay. Look, I've been very lucky. Blackie and Ottie are fantastic. Right. But if I send him a message, I'm worried. I'm there the next day. And that's amazing because, you know, your head can play tricks on you and you think, oh, I've got this.
So if somebody has had cancer, is it that they often worry when they get any kind of symptom that this is the cancer that's come back?
Absolutely. And it doesn't matter what anyone tells you.
Even you.
You get a headache, I've got brain cancer.
Okay.
No, I've got, and you know, you can't, it's normal, you know.
And people listening need to know
it's normal.
That it's normal. I can take it a step further. Even if they themselves have not had cancer, but somebody close has had cancer, and they get a symptom, they often think that they too have cancer.
Yeah. But never Google, ever.
Okay.
I have never ever Googled anything. And he'll tell you, I don't know what type of cancer I had. I had cancer. I had bone cancer. Yeah. So I also think once you give it a name, you kind of faint it. Hi, I've given you a name, you like here. And for me, never.
It's not your way. You're rather
I'm going to, well, he's studying all the years. So, I mean, why would I go to Google and go, Google says this?
So, like Blackie mustn't give up his day job.
No, he's not allowed to. He's not allowed to ever retire.
All right.
And this, I promise you, I had a colleague and he got cancer. And he came to me and said, and he had bone as well. And he went, it says I've got a 70% chance of dying. And I went, no. And you know what? He died. Because it was in his mind.
Self-fulfilling prophecy. Yeah. Did Google tell him that?
Yeah. He Googled the cancer he had and everything.
And he talked himself almost into it.
Well, then you do.
So, go on.
To my next operation. Okay. So after, in 2013, I had the big operation again, and then a few months later, the bone started dying again. But then, what happened was I have got it looks like a bicycle chain running from here to here. And that stuck out. Well, I don't know what you call it. But
is it an implant that you put in?
It's a long bone reconstruction plate.
Okay.
It's a plate, but it does look like a bicycle. Anyway, so that stuck out. So then Ottie said, fine, what we're going to do, we're going to take skin from your arm and we're going to cover it, because you've got to cover it, okay? And I went into hospital for what I thought was just a skin transplant. And unfortunately, it went wrong in the way that, first of all, I came out and I started hemorrhaging. So I had to go back into theatre. So I came out again, and then the transplant that they put on started dying. So they took me back into hospital, into theatre, sorry. But once I was there, unfortunately, my blood pressure started dropping. And for 2 hours, I was unstable. So they phoned my family and said, look, yeah, prepare yourself for the worst, it's not looking good.
And this is 2013.
Right. A year I'll never forget. Anyway, I woke up and I had everything on me, all the machinery you could think of, because, yeah. And they said, look, you can either go home in a day or otherwise you wait, and then we're going to do a flap. And a flap is when they take part of your breath and they put it on your face. That's why I have that cut. Because you get all the blood vessels and everything in the tissues.
The breast has more blood vessels in it?
It is because that is the source of where the blood comes from. Okay. So you take the source. So when we did the bone grafts, you take the blood vessels as well, and that you fix to the neck, your external venous system. So you actually put it so that it can have blood supply and the blood being flowed out. So it's an exchange of blood that you need. And with the tram flap, it is much easier for the blood to get there, but it's got to form an own plexus to go away again.
And that presumably takes time.
Yes, but the first couple of days is very important, because then immediately you know if your flap is working or not.
And in that process, do you need to take medication that's anti-rejection?
No, it's your own.
It's your own, okay.
No, you don't, but you end up having a lot more than you should have, because you have to have operations afterwards to reduce it.
You mean you have a lot more material?
Yes.
A lot, you've got a breast here, or you've got bones inside? Or...
No, it's skin, but it's a lot.
Not quite breast.
Not quite. Part of.
Is the muscle, muscle underneath.
Yes. So I still wanted to work. So I used to get buffs, and I got tape, and I taped myself from here. And I put the mask on so people couldn't see. And then I wore those. I had to wait for 3 months to get better, so that they could start taking it down.
You need a re-establishment of new blood supply before you can cut it out. So you can't do it too early. You've got to give it time to mature.
So how did you feel at that time?
Well, I was alive. It was a miracle. And I could still do my job.
You were working?
I was working. The work kept me going.
Your spirit and your humour and your work. At meeting, were you still front of the restaurant?
I was front of house, who looked like I was another religion, almost. And it was hot. But anyway, we actually, I managed.
And you bought pretty ones.
Yes, very pretty ones.
One of the things that I never felt for you, and even until today, I don't feel ashamed for you. No. I'm never over sympathetic with you. And I think that's
what I enjoy.
Isn't that what you need?
Yeah.
You need to be treated as a person.
Exactly.
And not as somebody with an ailment.
Yeah.
If I may add and interrupt, as I'm likely to do, we learnt when we were studying that sympathy is not a positive emotion to give to people.
No.
It says, you stupid football, you can't stand on your own feet ish. Empathy is another story. If you can offer empathy rather than sympathy, I think it's more helpful. But you were talking about some people saw Shannon as a little damaged, and other people saw the same Shannon as looking amazing.
What I want to say today, don't assume and don't tell people, oh, I believe you fell off a horse. I've had it all. I fell off a horse. Bell's palsy. But I think the worst ever was a woman that came to me and said, you know, you should really watch a program called Botched.
Oh my goodness.
And I never even knew what it was. And you know, it's a program for people who've had plastic surgery that's gone wrong.
Oh my gosh. This is what she told you?
This is what she said to me. And I was so shocked. But I was in a public place. I couldn't hit her over the head. Was really, because you can fix your face, she said. I mean, you can fix your face.
Did you just...
I was like,
gobsmacked.
For once I was gobsmacked. So I think never assume. You know, like you don't see someone in a wheelchair and say, oh, where are your legs? You know, my face is the same. My friend's engaged to an oncologist in America, and he specializes in people like me. And he said, I am the best he's ever seen. He's never seen someone who looks like me.
After 19 years.
After 19
years
After
with complications.
With complications.
He is a super specialist, and he is still giving Shannon exactly the same advice as what we are.
From distance, which is wonderful.
It was wonderful for us to hear that we are still on track. We do have a problem with medical aids, which don't see the foreseeable future that Shannon needs some oxygen therapy, and they refuse funding for that.
So at this stage, 19 years later, there is another step to go. And that other step is for her to have further treatment. It isn't surgical, it's oxygen or hyperbaric oxygen. That could benefit her bone growth. Is that
the blood vessels once again?
Okay.
To build that angiogenesis,
yes.
And maybe that is not set in stone, because how many people of Shannon's caliber is there still available to do a double-blinded study? Okay. It is stupid to do something like that. And now to take away that possibility for Shannon, I feel shame on you.
So you have spoken and motivated for her to have this after everything that Shannon has been through. It feels like a no-brainer, despite the fact that you haven't got the research with thousands of people, because there aren't thousands of people like Shannon who have survived with this level of spirit and positivity. So in fact, the medical aids would be benefiting her and you and themselves by offering this kind of treatment. In fact, it sounds like it's almost preventative.
Yes, and it not only came from myself, Dr. Otti van Zyl did it from his side, totally independently. Yeah. The hyperbaric oxygen center we've all motivated, but it is as if there's a block that doesn't want to let us through. it is very difficult in Shannon's situation to give a yes or no answer. As I said, she's 19 years cancer-free.
So there are not a lot of people that you can compare her to, but in your experience and with yours and your team's knowledge, it's a no-brainer.
And it was correlated with the advice that Shannon had from a prominent American physician as well.
The oncologist.
As head of oncology in Miami.
And they say...
And yet our medical aids say no.
And in America, they said they wouldn't hesitate to give me,
Go on with your story. After after you had the scarves and the hoods and you were still working, and then you needed to have more surgery.
Yes, because I had to have it made smaller.
Yeah, okay.
So I had to have another, I think, 2 operations. And afterwards, so then it got to where it is now, except I had a big dent. And then I had to have fat put into my face, which Ottie suggested to level it out. And that I've had about 3 fat insertions, where they take fat from your stomach or your legs, and they actually put it into your face. So I don't even know.
I may explain the reason for that. A jawbone has got 2 condyles and a fixed body. And Shannon's osteonecrosis came in the centerpiece. So what happened is it actually shifted over the fixed part, and thereby Shannon's face decreased in size, and therefore also her teeth went back. So she's now what we call a class 2 bite, which is a backshot jaw, which she really never was. She was a class 1, which is normal. And now, because of the shifting of the 2 bones over each other, it has to be masked. And that is what Ottie has done with the fat. So we've masked the defect of the bone by the fat injection, so that her face looks more symmetrical, although the jaw looks back. And she does not have a completely fixed jawbone in the front, as it is cartilage in between the bones, and a bone does that. So when she eats, it's not a perfect structure that goes up and down. It is a little bit of play in the anterior, which we constantly monitor, and that is where I monitor to see if there's any dead bone developing under osteonecrosis.
And you talked about the challenges of eating, something we all take so for granted. The biscuit, I offered you a cracker just now. You said no. I said it's fine. You did, it's fine. However you want to eat. No, I'll need to brush my teeth. Or sometimes if I'm having something, it might dribble down, and people will notice. What has been the challenges of eating?
Okay, so first of all, I can't bite into anything. Because I can only use this side of my door. I can't use this side.
So you can't bite into it like an apple?
No, I can't. But you learn, you know, so if you want to eat apple, you grate it. And anything that's super hard. And meat, I cut up very small. I also choke a lot. So I've got to be very careful. I can't eat big things.
So you've got to chew and puree. Puree, just small.
Just cut small. I don't puree because Black has always told me I've got to chew. I can't stop chewing.
For you to exercise the muscle.
Yes, otherwise it becomes ankylotic. It becomes fixated, and the bone grows together. So you need it to exercise.
So, but I mean, I eat most things. Just I won't bite into anything. I can't go like, oh, and pull, you know.
You know what not to do,
Yes.
and you know what to do, and Blackie has told you and given you the support. This you must do, and that's why. And somebody explains to you, it makes life very much easier.
No, it does, and you know, like, I know I need to have lots of serviettes because I have to wipe my face often.
Okay.
And yeah,
Practical.
and you know, even in restaurants where they know me, they'll bring me a pile of serviettes because they know that's
And there she smiles.
there. Well,
and also, obviously, sushi is not too bad.
no, it's not too bad, but I've choked on sushi.
So once we've had Shannon, Otti really took her a long way again. And then the problem was she had some dental implants placed before the surgery and before the radiation. And at this stage, the blood flow was so low that we lost 2 implants, and 1 tooth on the other side became or developed an abscess. And with that, you can think it's this major complication. It's not only a minor, it's a major, because we had to try to put 1 implant back at least so that she does have support on the right hand side, and the left hand side in this area where there was poor bone quality, we had to remove a tooth. So you can think of the preparations we did beforehand and how meticulous the surgery must be, because you don't want that to spread at all, because infection then in that area could be more than disastrous. And that unfortunately also developed. And the next person that Shannon saw was Paul van Zyl. And Paul is another amazing person that fits into the team. And I think which is very important in our field is that you never should hesitate to ask advice. You must never be above yourself where you think you know everything, because a person can just look at it another way, and that is to the benefit of your patient. We didn't study to the benefit of ourselves. I always say it is not our right to treat patients. It is our privilege.
Yes, absolutely. Feel the same way in the work that I do. It's an absolute privilege to treat people, and you're so hands-on and you're so technical and scientific with heart, and you give that. That's why you and the others in your team are why Shannon is sitting with us today, and how I have had the privilege of meeting her 19 years after you did. I think that they are pretty much a huge part of why you are here today.
Oh yes, definitely.
And you.
But you need a team.
With you in it, you're part of this team. And I joined late.
That's okay. Come to the party. Yeah, but you do, and it's like in life, we all need people. You know, you can't do things, no man is an island.
So my studies were with UNISA, and we don't study the person, and this is the problem, in an island. Like you say, we work in an ecosystemic way. Every person that is in your life, the situation, the weather, the everything, is part of where you are. And when we're talking, it may be nothing that we talk about in a session that hits a spot. Might be that we go to the door and you leave down my passage, and you or I say something and it hits and it goes ping pong, and it's life changing. And we never know what's going to move this system upwards and onwards.
Mm.
We don't know a lot at all about anything, and we definitely don't know about the future. I've got this thing about don't plan too much for the future because we don't know, for better or for worse. Stay in the present, do what you can, keep your spirit as up as you possibly can, do good, give, and it will go as it goes. Just go along the journey, and you're doing it so well.
Thank you.
And how did you go on from there?
Well, that's quite recent. I think last year I lost teeth, and I now have a denture, which he knows I'm not happy about, but what do you do?
It was what it was.
Yeah. And then it's another thing, you cope, you know, but
you adjust to change. You adjust to a change of your image. You adjust to a change of what works, what doesn't work. It takes time.
For me, there's some things in life you just got to say it is what it is.
Is what it is.
And you carry on.
Yeah.
You know, you just can't change it.
Do you know of anybody who is as resilient as you are that you can speak to easily?
Not really.
She's top of the pile.
I'm a bit no. You know, I don't know, just had strength, and I came from parents that were don't ever give up. You know, don't ever give up.
Okay.
I think that's where.
So that's the roots of this, but you're a trailblazer. And when you spoke to me, you said, I don't like to write. I don't want to write my story. You heard what I was doing and you wanted to tell your story. And then we got the pleasure of having Blackie on board.
Well, there might be someone listening who thinks, you know, this is the end, and it's not the end. You know? I mean, if we'd Googled me, I would be dead. 5 years, you know, that's, and
here you are.
Yeah, and, you know, and Charles was one person, he always laughs. He says, you know, if Coburg went up, he said, I would find you opening the door saying welcome. He says, because you just refused to die. And I thought that, you see, I love a sense of humour.
Yes.
That helped me a lot.
And it's also a black sense of humour is sometimes very good too.
Yes, you
survive,
do.
Yeah.
You need it, you know. I don't look at myself as being different.
As being a patient.
It's hard to explain, you know. Like, little children sometimes say to me, what happened to your face? And it doesn't worry me because they look at me from underneath. You know, my friends all say to me, we don't see your face, we look at your eyes and we, you know what I mean? So, and I think it's been so long that I've forgotten what was different. You know what I mean? I think the only thing was different that I ate differently. But I mean, I swim, I walk, I do everything.
So what you're saying is your grit and your personality. You'd been through life before. You'd been through hardship and you'd been through challenges and you dealt with these in a Shannon kind of way that you're proud of. If you look back, your life wasn't particularly smooth sailing.
It just got choppier.
Got more bumps and lumps as you went along. But before this, you navigated your life's journey in a certain way.
I was at work and I had toothache, and I thought, well, I better go to the dentist, you know, and I went, and it was a question of doing root canal or removing the tooth. And I said, well, remove the tooth, because it was a side tooth. And I think it maybe was a good thing, because maybe if I'd had root canal, that would have gone into the nervous system, and it could have been a lot worse. And then it just never ever got better. And you know, afterwards you think that's a sign of cancer.
In retrospect,
Yeah.
the decision that you made was a good decision.
It was.
And in retrospect, we make decisions in life. Your decision to go to the dentist on that day, and your dentist's decision to send you to...
Oh, but that was much later, after I'd had a few sessions of tablets, and they just thought in the beginning, well, it's just the infection.
And an infection.
Yes.
But when they did refer you...
Oh, he knew. The dentist knew. No, you know, that's why I said take a friend. And I didn't think about that. I just, because he said, because they might want to put you under. You know, and I wasn't very clued up about medical things. Now if you say you're going to put me under, well, why shouldn't I eat? And why don't you give me all these explanations? You know what I mean? I'd be more, you know. And
be more clook, more knowledgeable. Not
I'm like an expert hospital goer. And someone who hated hospitals became my new best friend.
Oh my gosh.
Yeah.
Oh my gosh.
And I think also what I want to say, if you've got a sick friend, visit them. That's what you need to do. You know, and because people want to shy away from you. Phone me and ask me how I am. It's, you know what, it's the best thing you can do.
And take you what? I mean, just on a very practical girl-to-girl way, when you know somebody who's going through stuff, what is it? Flowers? You arrived here with beautiful flowers. Is it flowers? Is it perfume? What is it?
I think, you know, the first thing is just visiting someone and just taking the time to say, are you okay? You know what I mean? And also never ever phone someone and cry. That was my worst.
No.
Absolute worst. When somebody phoned and said, oh, you got cancer. And I'm thinking, oh my word, what am I going to do? And then I was counselling them. You know what I mean? And it's like...
I had another question for Blackie. Did you ever feel like crying when you had a Shannon or a Shannon sort of look-alike, when you were so heartbroken by what was happening? Did you ever feel like you were really heartbroken?
It is, if you do oncology, it is sometimes heart-rending to do it.
Better word, heart-rending.
Because you do the best you can physically, what you possibly can do, and for some it does not work out the way that you want to. And most people cannot fathom what is going to happen and how they are going to react. There are many patients that I saw on a weekly basis that after making the first diagnosis, I never saw them without them crying. And it takes a little bit of your soul when you do that. But we were given an ability. Each one gets different abilities from the upper hand, what to do and how to do it. And if you've got good mentors and if you've got good colleagues to understand you, and you get a super patient like Shannon, it makes it worth every second of this of heartache that I had taken away.
I think that this is, in this house, in Lullaby, I've had healthcare professionals come about their own stressors. And I had workshops with health professionals before COVID, because as healthcare professionals, We're supposed to be super strong and not show any vulnerability. And a lot of us get burnt out because we don't do what you're talking about and perhaps share with our colleagues when we're feeling really vulnerable. And it should happen because we're human and we're not superhuman. And the light was shone on this through COVID, where there was so much happening with our healthcare professionals. But when there's support, and then when the healthcare professionals are caring for themselves, it's very important. And that's not about ego. That's, if we're giving, we need to receive. And we need to care for us to make us stronger to give more. And I think what you're saying is having a support, or one might have a partner or friends who you can share with and level yourself, reset. This house and me baking bread while we're talking is part of the way that I reset, working with stress and depression for 40 years and more.
I just think that in days that it's really going bad with you, and if you go through similar situations than Shannon, you can go back and listen to this again, because this is most probably one of the most life-changing events. I had the privilege to walk with Shannon for 19 years.
Wow, wow. I can't better that. I've always got words. I haven't got words to better that, but I have a little bit of tears in my eyes because it's so special. And as you said, such a privilege for me to join you here. Your long journey, me coming in near this time, but having you here in my healing place is very special.
Oh, thank you.
Thank you. Thank you for coming. Thank you for coming.
Thank you for listening.